This question is asking, which of the following is a common symptom of type 2 diabetes? So let's look at the choices. So option A says elevated blood pressure. And although we can see elevated blood pressure in comorbidity with type 2 diabetes, or maybe as a risk factor for type 2 diabetes, let's look back at what the question is asking for. And in this case, it is asking us for the symptom. And a symptom is something that a patient feels or that they express in relation to a certain health condition. So elevated blood pressure is not exactly a symptom of type 2 diabetes. So we could eliminate option A and look at the other choices. Option B states persistent cough. And persistent cough is not typically a hallmark symptom related to type 2 diabetes. Maybe they happen to have a persistent cough, but it's probably not related to the condition of type 2 diabetes, so we could eliminate option B. Option C says increased thirst. And this is typically seen with type 2 diabetes because of the rising blood sugar levels. What happens in type 2 diabetes is that the sugar levels are rising, and this is because the body becomes resistant to insulin, which is used to lower blood sugar, and then the glucose levels rise, and as a result, the patient will feel very thirsty, and they'll drink more, and they'll start using the bathroom more. But ultimately, yes, that is true. They have increased thirst in type 2 diabetes, so this is the correct choice, option C. But let's look at option D as well. Option D states muscle aches, and muscle aches is not a typical hallmark symptom of type 2 diabetes, and the question is asking us for common symptoms, so this isn't something that you would typically see, so we will eliminate option D as well, and we will go with our choice C, increased thirst as a symptom commonly seen in type 2 diabetes.